A single, innocent mistake in paperwork may soon shutter one of Hayes' lifelines for people living with severe mental health challenges. The emotion surrounding this story is palpable. Imagine realizing that a clerical error could rip away a safe haven from some of the most vulnerable people in your community. But here's where it gets controversial. Should an oversight like this really be enough to jeopardize critical mental health services? Let's peel back the layers of this complex situation and look at what's truly at stake and why this issue demands our attention. High Plains Independence, a crucial nonprofit in Hays, Kansas, dedicated to supporting individuals with significant mental illnesses, stands on the brink of a temporary closure, not because of lack of need or passion, but due to a simple yet devastating paperwork oversight. This group, made up almost entirely of people managing their own mental health diagnoses, including every member of the staff, offers absolutely free, judgment-free support. Think about that. A place where folks in crisis can drop in, join a support group, or just connect with someone who understands their struggles, all at no cost. If you're picturing a massive, bureaucratic institution, think again. High Plains is a consumer-run organization, one of only 8 in the whole state, meaning it's run by and for people with lived experience of mental illness. They provide everything from drop-in centers to support groups in both Hays and Great Bend, stretching their reach with regular outreach even to the state mental hospital in Larned. Before this, the only real requirements for these vital centers were a television set and coffee. Yet today, High Plains is a hive of activity and encouragement 6 days a week. So what happened? Following an audit by the Kansas Department of Aging and Disability, the agency responsible for their funding, it was discovered that High Plains Independence hadn't submitted the required 990 IRS forms for nonprofit status maintenance since at least 2014. Here comes the part that will surely spark debate. According to Jenna Anderson, the organization's executive director, no notification ever reached her, not from the state, not from the IRS, not from their accountant. Anderson, who stepped into her position back in 2011 by chance rather than formal training, admits she's been asking for director education or assistance for years, yet turnover and lack of communication left her and the organization in the dark. Many might be quick to lay blame, but should small nonprofits be left to navigate complex tax laws and financial regulations without more robust support from their funders? Anderson herself points out, you can't do what you don't know. Does a system that expects nonprofit leaders, many with no background in tax law, to juggle endless forms while also fostering recovery and hope, carry some responsibility here? The fallout is immediate and severe. Without their nonprofit status, High Plains can't receive state funding. Their modest $125,000 annual budget barely covers expenses, 3 part-time staff, a rented facility, and a small vehicle just to keep daily operations running. Right now, costs average $12,000 per month, and with the deactivation of state funding, Anderson fears they won't be able to make payroll for August. Desperate to keep the lights on, High Plains is seeking help from the community to bridge the 3 to 6 months it could take to regain nonprofit status. They've hired a new accountant and begun the arduous process of refiling everything with both the state and the IRS. In the meantime, they are hanging by a financial thread. Who would be hurt most by a closure? High Plains is not just a program. It's a community, a family, a lifeline for about 35 regular members in Hays, plus another group in Great Bend. Many are seniors or on disability, often dealing with feelings of profound isolation. For some, like a member who spent years in Larned State Hospital, hearing Anderson speak was the first glimmer of hope he'd ever felt. These stories aren't rare. Whether through peer support groups, crisis outreach, or even just providing a cup of coffee and a friendly ear, High Plains is often the thread keeping people out of hospital beds or away from jail cells. Worth noting, another layer you don't always hear about. High Plains now also supports Hays's Assisted Outpatient Treatment Initiative, previously funded by NAMI. These are complex cases. People who cycle through hospitalizations or encounters with police, now given tools to handle their illnesses on the outside. Anderson, as both a leader and peer, bridges people to resources and instills hope. Think about the ripple effect if these services suddenly disappeared. Yes, there are rules about medication, but here support comes as a nudge from a peer, not a command from an authority. And members celebrate milestones together, birthdays, holidays, even memorials when someone passes. It helps fill the void left by family estrangement, itself all too common. The impact is clear in individual stories. Linda Beagley, managing both bipolar disorder and a recent Alzheimer's diagnosis, says the support she finds at High Plains has become essential as her life changes. Another member, now sober for the longest stretch of adulthood, credits this environment's understanding for helping him avoid relapse. Phyllis Park, after a suicide attempt, said the support from her High Plains family might have saved her life. But now, with the very existence of this resource in jeopardy, many members don't know where they'd turn for basic emotional safety. Anderson is frank. Losing even her modest income here would mean finding a new home not only for herself, but also for the 12-year-old child in her care. We just can't close. What are people going to do if they don't have this place to come to work on recovery? She urges the public. Donations, even just for the next few months, could keep hope alive. Checks can be mailed to High Plains Independence, P.O. Box 956, Hays, Kansas City, 67601. Every dollar lets their members know the wider community still cares. This entire situation invites heated discussion. Should technicalities be allowed to jeopardize the crucial safety net for people at their most fragile? Or do rules and regulations provide the necessary guardrails to ensure trust and accountability? And most importantly, if you or someone you love were depending on a place like High Plains, would you think the system had your best interests at heart? Let's open the floor. Do you think the state should step in to provide more direct organizational support to mental health nonprofits? Should exceptions ever be made for honest mistakes in paperwork when real lives are on the line? Share your thoughts and let's talk about what true community support really means.